With decades of experience and the most advanced equipment there is, the urology team makes it their mission to handle prostate issues for men and provide health and peace of mind. We stopped in to talk with them about their methods and their approach.
When I look at my experience here, I've been in Austin for 32 years with the urology team, and I've been here long enough to realize that patients come to see me and see the other physicians in the urology team because they want to have our experience. And so when I see them, I have to think that I could be easily sitting in their seat. And so what would I say to them? You know, if my father were sitting there or my brother was sitting there, I would say, if you have an issue with your prostate, then you need to come and see us. And if it's an issue of prostate-specific antigen elevation, then I think that I would tell them that they need an MRI. In 2011, the urology team introduced prostate MRI to Austin, Texas. The prostate MRI has been the most important tool to identify men who may need a prostate biopsy. And so now it has become really state-of-the-art across the United States. So Mr. Smith comes in to see me because of his elevated PSA. He then goes and gets a prostate MRI, and his prostate MRI may come back looking like this. We see his prostate as outlined, and this is the picture that I will show Mr. Smith when he comes in to see me. So this green area is the target, the suspicious area that Mr. Smith has. So he comes in and talks to me about that. I show him that target, and then we will prepare him to do a prostate biopsy. The UroNav machine has two things about it that make it so special. This unit up here is a GPS unit. This acts like the satellite system, and it reads a chip that's in the probe here. And as I move the probe around, I can watch it on the screen, and this allows me to make sure that I can accurately get through the areas in the prostate that are suspicious on the MRI. In 1990, the positive biopsy rate was 25%. In 2015, at the urology team, the positive biopsy rate is 85%. We can now see all the areas to biopsy and can keep a detailed map of each prostate. So Mr. Smith comes in to see me, and I say, Mr. Smith, this is the area that we targeted, and these are the cores of tissue that we took. So we can rotate his prostate, we can look and see if it's on the top or on the bottom and right or left. So this helps me explain things to the patient. It also helps me in following this gentleman so that in a year from now, we can go back and look at this if we need to rebiopsy him or not, and see if there's any new changes or if there's new areas of tumor that weren't there before. So if you have an abnormal PSA or have had several biopsies, please come to the urology team and talk to us about the most up-to-date, state-of-the-art approach to prostate issues.
For more information on the UroNav Fusion Biopsy System and the urology team, call 512-231-1444 or visit one of their locations in Austin, Round Rock, and Westlake. You can also find them online at urologyteam.com.